When pathology trainees ask me why should I come here to train at Cincinnati Children's, my answer is very simple. The hospital will give you everything so you become a better pathologist. And for pediatric pathology fellows, that's really important because that means that they get to work with us and they form an active part of that process in the diagnosis of disease.
I came to Cincinnati Children's Hospital because of its reputation as one of the best pediatric hospitals. And what I love most about my fellowship is the people that I got to work with in the department. It's just so welcoming.
Our division sees more than 15,000 pediatric surgical pathology specimens in 1 year. Our fellows are also able to see more than 1,500 cytology specimens and over 1,000 new consults that come from different other institutions. We also have a busy autopsy service, I would say one of the busiest in the country for a pediatric institution with over 100 autopsies per year. That actually represents a high volume for our trainees, but also breadth of exposure.
So we have about 120 autopsies a year. The fellows here are gaining tons of experience, and I always am checking on them to see what I can do to support them. It's important because we don't want the fellows to feel burnt out and to feel like they can't accomplish what they want to accomplish.
I decided to do a Pediatric Pathology Fellowship because my residency training didn't have a lot of exposure to pediatrics, and I wanted the extra training to allow me to be a more well-rounded physician. One of the things that sets Cincinnati Children's apart from other programs is that our leadership here is really involved in innovation and being on the forefront of new technologies. So not only are you getting trained in pediatric pathology, but you're also getting exposure to all of the new movement in our field.
So the future actually, in my opinion, is going to be a blend of specialized pathology and digital pathology. We are preparing the next generation of pathologists to really go out there and be at ease with the technology that is available, or even bring up technology that may not be there. There's new centers where they're going into work.
And you will be able to graduate not just as a highly skilled pediatric pathologist, but at the same time, we're putting together all the steps that you need to understand how pathology is going to be practiced 5 and 10 years down the road with our digital pathology approach. So you should definitely consider that.
I'm going to be staying here at Cincinnati Children's and will be transitioning to faculty in July. I'm excited to be a part of the autopsy service as well as the congenital cardiac service. So I will be working both on the clinical side with families, but also in the research side, figuring out all sorts of things about how our patients can get improved care.
Our philosophy as a fellowship program is keeping a fellow-centered approach. So our mission is based on a premise that is, we work for the fellows and with the fellows, not the other way around. We usually have monthly meetings where we gather with our fellows and we just talk about issues that they might be concerned with.
After my fellowship, I decided to stay here actually because of the people. I just love working with everyone. Everyone's just so good here.